HAP, or Health Alliance Plan, is a Michigan-based nonprofit offering an array of health insurance plans, including Medicare and Medicaid plans. With recent changes to those, it's a good idea to take a fresh look at your plan. And joining us today with more information, Natalie Percola and Kyle Ingram from HAP got all of the answers to all of those questions that you may have. Because, by the way, welcome. I should welcome. Hello. Thanks for being here.
Thank you.
I just want to jump right in because we were just speaking. Open enrollment plan for me equates with fall, but you're saying for Medicare, now's the time.
Correct. So every year, if you're on a Medicare Advantage plan, when the year starts on January 1st, you actually have a Medicare Advantage open enrollment time frame. So that's January 1st through March 31st to make a one-time change to your plan. So it's a great opportunity for those people that maybe they made a change this annual enrollment period and they're testing out their plan and seeing if it's working the way they want it to, or if they didn't get a chance to review it. They thought, hey, no big changes, it never really changes much. Well, as we're going to talk about later, there was a lot of changes this year and it may be a time to take a look.
Let's talk about that because people often do that. I do that. Where the open enrollment for me, when it comes around, I'm like, well, nothing's really changed. I didn't hear about anything and all my check looks fine. I got everything set aside, so they don't. Why is it important each year to look at that?
Yeah, so Medicare Advantage plans change every year. There's always something that happens. Co-pays raise or lower, prescription drug costs may change, and your actual health situation changes year over year, especially when you're on Medicare. Unfortunately, that's kind of the time you start to have a lot of different things go on. So it's really important that you sit down with a local broker or agent or call into your carrier and you're getting a review of your plan, making sure that it's still working for you in the way that you originally intended when you signed up.
And you really want to do that. You say it changes every year. It's changed pretty big, but before we dive into those details, what happens if you miss it? I mean, what could happen? What are the consequences of not doing
Absolutely.
this?
So if you don't review before the end of March and decide, yes, I want to stay or make a change, you're there until the annual enrollment period comes around this fall for a 1/1 effective date. So you really want to make sure you're taking the time, review your plan, make sure it's still working for you, getting all the information. I always tell people they can go to medicare.gov to see about some of this information, or we have a ton of resources on hap.org/Medicare that they're able to review and educate themselves, but also I always say talk to a local broker, call into the company, have somebody walk you through it because it can be confusing.
And Natalie, we're going to dive right into those changes because we were just discussing this out-of-pocket cap that's been put in is pretty drastic. Can you speak to that?
This is a huge change for Medicare prescription coverage, probably the biggest change since the creation of prescription coverage under Medicare.
Yeah.
So if we think about last year, the out-of-pocket cap was about $8,000. When you apply that through the different phases of coverage, which can get pretty confusing, it was about $4,000. This year, it's $2,000. $2,000 real dollars out of your pocket, and you're done for the remainder of the year. That is an incredible savings and value to a lot of individuals, and that's also the reason that many plans are kind of shaking up cost shares on the medical side, supplemental benefits, and other things, so that really is the perfect time to take a look.
So you were saying before the cap was in the over 8,000, but through certain programs, through certain things, you could get it down to 4?
Thereabouts, yes.
Okay.
Yeah, depending on your ratio of brand to generic drugs, super complicated math.
But now, it's just 2, period.
$2,000, no more. No more. You will never pay more.
Well, that's an amazing. I bet people who didn't know that now are doing a spit take with their coffee.
Exactly.
What a amazing savings. Talk a little bit about the cost over the year. Who benefits most from this? I mean, obviously, as you mentioned, things happen. Your health changes. This is benefiting who the most?
Definitely individuals who have high prescription costs. So then we have 2 wonderful things that are happening for them. Obviously, if they hit the $2,000 maximum, they don't have any additional cost. And there are lots of drugs, many of them on commercials that you may be seeing around this time, that are $3,000, $4,000, $5,000 on a monthly basis.
On a monthly basis.
It is not uncommon for some individuals to hit that $2,000 cap in January or February.
That's amazing. You see the commercials, but you never, if you're not researching that or interested in that drug, you're maybe not looking at the price. You're saying some of these 1 or 2 prescriptions and you've already hit your deductible.
So anyone who is in those large cost amounts, they've got this new $2,000, they're definitely benefiting. But for those that had prescription costs of maybe $600 in a month, enough to make your wallet go, ouch.
Right.
How am I going to, feed this into everything else? But not so much that they would necessarily have a hardship. There's an additional benefit this year. This is the Medicare prescription payment plan, which lets you, instead of paying at the counter, You trade the dollars, they trade you the meds. You're actually able to shift to an invoicing process through the health plan. So you get to pay over the months of the year, pushing those costs instead of $2,000 in January to $166 or so every single month for the remainder of the year.
So you're saying you can actually hit the cap and pay it off in payments?
Yes. That is brand new for this year as well. So you've got both of those things happening.
Wow. Talk about putting more dollars back into an individual's pocket to be able to buy groceries or gas or whatever. Well,
Eggs.
Well, let's not get crazy.
Yeah.
Eggs may be out of reach.
Yes.
But how do people get this information? I'm sure your website has a lot of information. Are there any events or is there any workshops? Is there any type of way that people can learn more?
Well, we absolutely have information on our website.
Yes.
We also have a dedicated call center.
Perfect.
Because these are changes to Medicare, every single plan has something, a phone number, a line to get assistance. And I really think brokers and agents are another great place to bring it all together, to say pharmacy changes and medical changes and help to translate what it means to you, because it's really that translation part that is all the work.
Well, Kyle, Natalie, you've pretty much put the onus on anyone watching right now to act, because I'm assuming the worst thing you could do here is nothing.
Yes, then you'd be locked in for the rest of the year. And of course, all of those calls are free. The conversations are free. Agents, brokers, health plans, it's all free.
Now, you may have just been casually hearing this in the background while you're doing the dishes saying, what, a 2,000 cap? Go to this website, all right? hap.org/Medicare. Get the information you need. Medicare changes are in effect all year, and that open enrollment period ends at the end of this month. So get to the website and learn more from hap.org. We'll be right back.